Hello, everyone. I am Nurse D. Porche, and if you are new to this channel, here on this channel, we discuss all things nursing, health, and finances. I have a super special guest. As we know, the month of May is Mental Health Awareness Month, and so I have a special guest just to talk to us a little bit about our mental health. And so, without further ado, I'm going to let you introduce yourself and then tell me something about the mental health space that you will never forget, that you learned in this space that you will just never forget.
That might be a hard one. But good evening or afternoon or morning, wherever you are, your viewers who are watching virtually. I am Dr. LaClisha Izzard, fondly known as Dr. Izzy, and I am a licensed professional counselor, as well as a clinical supervisor, as well as a professor in the area of counselor education. I am a native of Greensboro, North Carolina, Aggie Pride. I'm also an alum of North Carolina A&T State University, which is the largest HBCU in the nation. I'm also an alum of Fayetteville State University, which is another great HBCU in the Great Pine State of North Carolina. But I am also a proud resident currently of our wonderful Peach State of Georgia. And I have been a resident of Georgia now a little over 20 years. So I would say I'm a Georgia peach. This is home. So I always tell people I have two homes in North Carolina as well as Georgia. But getting back to the question at hand, a little bit more about kind of what I do and where I am in the mental health space and things that have kind of stood out to me. I've been in the clinical mental health space now for a little over 20 years as well. Everybody always says, "Oh, you look so young." Yes, but I started out even younger. I know. I started out, actually, I became a licensed counselor by the time I was 26 years of age. So again, I have been in this space for quite some time, and I've seen a lot of evolvement in this space over time. And so when you really start to look at something that probably stands out to me the most as it relates to the mental health field is the way that it changes. It does. It changes very, very rapidly. So for those of us who are clinical providers, we have to keep up with the knowledge and with the research. So I am a conference guru. Literally, conference season is coming up for me starting this month. And I probably, by the time September gets here, will have attended 6 conferences by then.
Wow. And see, I met you in the conference space. So see, that is amazing. So you're doing a lot of conferences. Is it surrounded, because I know you have one coming up geared towards mental health. What are the other ones, if you don't mind sharing?
Absolutely. So the one, of course, that you're referring to is the one that I founded, which I first titled it African American Male Wellness Symposium. And I tweaked the name a little bit just to ensure that we decrease, of course, any stigma around mental wellness, because that's an area we're still working on in the mental health space, is decreasing stigma. And so I retitled it Black Men Thrive. And so now I'm doing it in partnership with my church, which is Berean Christian Church in DeKalb County, Georgia. And it has just been continuing to grow and been a great success. So again, I'm grateful for that idea that God put in my heart. And it's been such a blessing to not just Black men, but to our African American community as a whole. So again, just so grateful for that. But as far as all the other conferences, yes, they all have a mental health association connected to it in some form or fashion. I've been blessed to now attend. This will be my second year attending the largest crisis intervention conference, which is called CIT, Crisis Intervention Training, and that is something you can learn more about. We may get into that with some of the questions later, but it is a community course that can be taken as well as for law enforcement to learn how to really be able to associate and work with people who may be in a mental health crisis, and learning how to direct them to treatment versus directing them to the corrections area, so jails and prisons.
Wow. Wow. Okay, that's awesome. That's
So
needed. Oh my gosh.
great conference. It's actually an international conference. So when I went last year, you had about 6 other countries that was represented there as well. And so I'm really excited about attending that conference again and learning more in another week. I will be at my first mental health and criminal justice mental health court type conference, which I've been told that conference averages over 7 to 8,000 people at that particular.
Wow.
So
Wow.
that's gonna
You're
be
making impact, impact,
exciting.
impact. Wow. Thank you so much
And I
for
actually
serving
will
in this
be, yep.
space.
And I'll actually be able to present at that conference. And I'll actually be presenting on programs right here in our great state of Georgia that we are using to divert people, of course, again, from the jails and prisons and ensuring that they enter into treatment where they should be. So really excited about that. Some local conferences here coming up in Atlanta, co-responder model as well, which focuses on a team that comes out, law enforcement, a behavioral health clinician, as well as a person with lived experience. Whenever there's a crisis that comes up, that team goes out so that they can work with that individual and hopefully get that individual into treatment as well, instead of, again, them going into the corrections system. So just really, really excited about all the conference that I'll be attending. Is something that I share with individuals all the time, is that we really have to invest in ourselves. If you really want to be able to grow in your space of impact, you're going to have to grow with knowledge, and you're going to have to invest in yourself. Now, I've been really, really blessed this year because, and this, Ms. Ida, that we actually I serve in leadership for one of the largest mental health advocacy organizations right here in our great state of Georgia. And then I also serve at the national level for the same organization. So again, if we are not putting the work in, like I like to say, the boots on the ground work, y'all know the new song that's out by 803.
Boots on the ground.
But we really, really do the boots on the ground work. And so when you're a part of organizations like that are doing the boots on the ground work, and you continue to grow in leadership in those organizations, the blessings are immeasurable that will come to you and the opportunities. And that's what I'm experiencing right now.
Okay, so I'm seeing that's more of like a professional space. We're seeing more and more that mental health crisis or issues are happening in a public space. You may be at a grocery store and witness somebody, having a crisis, or, at the nail salon, whatever. And how do we educate a person who's not in a professional space in which they're dealing with that on a continuous basis? How do they find that education where they can learn how to interact with people going through mental health crisis?
Well said. Well said. I know exactly what you're talking about. So you're saying, again, the community resident, the layperson, how do they know when they're seeing signs and symptoms that are out there? And again, it's multiple areas of what we call behavioral health. So we're looking at mental health crisis. We're looking at a substance use crisis, possibly both happening at the same time. But for, again, individuals like that want to learn, we have free courses that are out there that are available, that are offered to you from many of our nonprofit organizations. So the mental health organization I was telling you about, which is the National Alliance on Mental Illness, they do mental health-based courses, free courses all the time. So we have something called Basics, NAMI Basics. We have something called Peer-to-Peer. We have another one that focuses on, again, individuals just learning, again, about crisis intervention as a whole. So those classes are ongoing and they're always free. We also have something
free.
Free of charge. All you have to do is go to the website. If you're here in Georgia, it would be namiga.org, so NAMIGA.
And I'll put it in the description. Okay.
Absolutely.
Yes. So
and the other
and I just did a health event where they were right next to me, the NAMI table. And so we were kind of working together, giving out information. So I love that. I love that. So I'm definitely going to put that. If you guys didn't catch that, I'm going to put that name of that organization where you can find free courses to educate yourself on what to look for when someone's going through a mental health crisis and how to act, right? Because
Absolutely.
you can either exacerbate, you can make it worse, or you can make it better. So we need to educate ourselves because we're finding that it's happening more and more. Now, do you find that, because you've been in this space for, you said, 20 years, do you find that it's more so at a greater percentage rate than it was maybe years ago, 5, 10 years ago? Because I don't know why I feel like it has gotten worse, but I don't know if it's because now we're seeing it more because we have social media where we can visibly see it versus it happening and we didn't know about it before.
Right. So, and before I jump into that one, I want to give one more resource for lay people. There's a course called Mental Health First Aid. And then they also have one for adults and they have one for youth. So that, again, the regular community resident family member can learn more about signs and symptoms and other resources. There's also one called QPR, which is Question, Persuade, and Refer. That teaches you how to be a suicide prevention gatekeeper. And so that's someone that's able to recognize signs and symptoms of someone that may be suicidal. And again, all of these courses are free to community individuals. We actually have an organization here that serves Newton County, serves Gwinnett County. It's called Guide Inc., INC. And they're the ones that provide the youth mental health first aid, the regular mental health first aid, as well as the QPR training. And again, free to you as a Newton County and a Gwinnett resident. Okay. So I wanted to share that.
Thank you. Yes.
Before I jump into this question. So when it comes to mental health as a whole, mental health, of course, has always been present. But unfortunately, mental health has been misunderstood by a lot of people, whether that's been in professions, whether that's been in our faith-based community, whether that's been in our actual government and then our local communities as a whole. It's been misunderstood. So what we're starting to see more now is individuals becoming more aware and individuals getting more education. Hence, why the month of May was deemed a National Mental Health Awareness Month. So this is the opportunity for us to get out there and push more and more events to help educate populations of people in different communities and departments about mental health awareness. And so we're seeing now more knowledge that's being freely given out and being open. Of course, since COVID, we are actually been able to see more of the stigma walls break down. So right after COVID kind of started, you started hearing about mental health on the radio, you started seeing it on the television, you're starting to see it more on social media. So that was the part that was really different. But what has happened over time is years ago, we had what we call those really big asylums, those really big hospitals that housed individuals usually with mental health, severe mental health challenges and conditions. However, for some reason, the government thought that it was a good idea to get rid of majority of those hospitals and those asylums. And they decided to, okay, well, we'll just give people more of outpatient treatment and, give them medication and kind of let them take sole responsibility of their own mental health. And so much of that is kind of just fell by the wayside, of course, and been a challenge for most people trying to be able to adjust to their own mental health condition and learning how to take care of that. So that is some of the challenges that we've seen over time due to that. But what I can tell you about our great peach state of Georgia, things are changing. Things are changing. I serve on the advisory council for our Department of Behavioral Health for our particular region. And one of the things that we've been able to do now where funding has been put in is in development now of more hospitals in Georgia.
Oh, that's awesome.
Yes. Is
that
working
new?
on it now. Working on it now.
Nice.
Renovating, and all of that came from legislation. All of that came from new legislation. We have a new behavioral health commissioner now. His name is Kevin Tanner, and he was formerly a state representative. So he came to us very knowledgeable about government and about legislation and understanding how we need to obtain funding. for things like this. So we really, really have been put in a great space by having
That's
him
awesome.
as our behavior health commissioner now for DBHDD. So again, slow, gradual changes, but changes are taking place. What you have to understand about the state of Georgia, we are 47th in the nation to access to health care and mental health care. So we're at the very bottom. So because of these new strides that we're having, all of this is still really, really good news. Really, really great opportunities are coming down the line. But again, it's baby steps. So our last really, really huge legislation that was passed was in 2022, where the governor signed off on our Mental Health Parity Act. Hence this shirt that I have on right here today, y'all.
Oh,
Georgia
nice.
Mental Health
And that
Parity
was
Act.
in 2022?
That was in 2022 when that was signed into law. And what mental health parity stands for is for insurance companies to treat mental health the same as they would physical health conditions.
Oh, that is so needed.
Currently, but the challenge actually that we've been having is for the insurance companies to really get on board and abide by. So, like I said, it's been in law now for the past almost 3 years, but we've really been having a challenge getting the insurance companies to really jump on board.
What can we do as citizens? What can we do to help push this out more?
More advocacy. And actually, again, this particular shirt that I have on, we had our first Georgia Mental Health Parity Day at the Capitol. We had that this year in January. Actually, I think it might have been February. But coming together again as advocates, sitting back down at the table, identifying different things, different areas that we can, reach in order to get this information to the insurance companies. So one of the things that came out of Mental Health Parity Day at the Capitol, one of our elected officials that's been serving over 20 something years too, she said, build those relationships with your elected officials. She said, you should know who your elected officials are for your district. If you don't, you need to make sure that you know that and start setting aside time to be able to meet with them briefly. We know they're very busy, but if you can get in with a 5 or 10 minute meeting from them, you want to do it. Because again, she said your elected officials are going to be the ones that's fighting for you, of course, in the Georgia General Assembly. And so what that means is if they have to go back to the drawing board to again ensure that the insurance companies are doing what they're supposed to do, of course, we're going to need that backing from our elected officials. So that was just one of the areas that came out. And then, of course, in whatever areas you're working in. So like I said, in regular health care, making sure that you're being an advocate, making sure you're attending certain events, that your organization is having and standing up and being able to talk about the value and the importance of mental health treatment. Right.
Okay. So advocacy, education, I'm hearing just continually showing up is what's going to help drive us into where we need to be. Now, let me ask you this, because I know you said we're working on, there's hospitals coming and outpatient and all of that. And I'm thinking insurance, money, right? And we know that right now the economy is not where it used to be. And a lot of people don't have probably the access to these outpatient and hospitals, to the outpatient setting or the hospital where they need to receive treatment. So for these people, what is a resource for them? Like, is there anywhere that they can maybe educate themselves on their mental illness? Or is there anywhere that they can go without having insurance or money to pay for the services that they need? Is that an option?
I hear what you're saying. Well, in situations like that, and that's been one of the challenges that we make sure to advocate for. We have something called Mental Health Day at the Capitol every year in January. And that's one of the things that we do. We teach individuals with lived experience, which are individuals that we call peers, individuals with lived experience with mental health conditions, with substance use challenges, suicidal ideation or suicidal attempt background. But individuals with lived experience, we teach them how to advocate for themselves with their elected officials. And so, again, being able to bridge that gap, having those relationships, letting your elected officials know what the challenges are, where they lie, can be a help, can be a support, because government, we know, have access to state funding. They have access sometimes to federal funding that's coming down the line to us. But the other piece about that is just, again, identifying some types of insurance, whether that's with the marketplace. I think Georgia has their own now called Georgia Access now that's out there, but identifying again those particular insurance policies that have mental health connected to it, mental health treatments. Many of our insurance policies have some form of it. Some people just don't know. They haven't looked at it, such as in my online account. When I went on there, I saw where it said, mental health counseling available, through Teladoc. And I was like, wow, I didn't even know my policy actually had it on there. And I'm actually a provider for Teladoc. So again, many times there is telehealth that is attached to our policies that we may not know. So just making sure you're calling your insurance carrier and identifying if you have mental health coverage that is there. Making sure you're taking that opportunity to utilize it. The other space is with your employer. Many employers offer something called EAP, which is Employee Assistance Program. This is very short-term and brief counseling, but it's something. It's something to get you started. So some companies will offer you 5 sessions, some will offer you 3, some will offer you 8, some will offer you 12. And I've even seen some offer as many as 20 or 25 sessions. But again, you want to make sure that you're finding out what you're putting money already into.
Right. Yeah.
You may have access to mental health care or mental health treatment and probably just don't know about it.
Okay. So EAP, and then just checking with your insurance plan. Call that number on the back of your insurance card and simply ask if they cover mental health sessions through your insurance plan. And most of the time, if you do it through, you said telehealth, then it's included. I don't think there's a copay or anything like that, because I use my own. I'm in therapy with Kaiser, and so they offer it with my plan. It's already included. I don't have to pay a fee or anything like that to meet with my mental health therapist. And so you may already have it. I didn't even know for a long time that was part of my plan. So you're right. You're absolutely right. Reaching out to your company, and then EAP is another one. And then there's also, if you're experiencing like suicidal thoughts or anything like that, there's also a line that you can call, right? Is that a free line? Is it 988?
That's correct. And that came through legislation.
Line.
Yeah. And that came through legislation, again through us advocating as mental health advocates. So 988 went live in July of 2022. Okay. So again, still very new.
Oh, so that's really recent.
Very new.
Yes.
A little rough around the edges in some areas. But yes, we are still encouraging people. Please call. Georgia's a little unique because we already had GCIL, which is your Georgia Access and Crisis Line. So they were able to jump on and be a part of 988, which has been a good help to Georgia. But yes, 988 if you're in a mental health or substance use crisis. Also, you can call 988 if you just need resources. If you need resources, if you need to be connected, there's certain things you don't know, you can also call the line to get resources as well.
Okay, so even if you're not sure if you should be calling or not, then that's the place they can call and they can route you. So if someone is to call 988, but they actually needed to call 911, they can route them into that system, or...
They probably would have them to hang up and call 988 because, like I said, there's still a little kinks that they're trying to work out. And like I said, even if you think about 911, they said it took probably a good 30 years before 911 got to be the way it is now, just really perfect.
Wow.
So so they said 988 may take some time. So there's still some kinks, like I said, that they're working out, but they are doing it. Some people have kind of gotten a little nervous about some of the things that, like you said, we've been experiencing with the economy as it relates to Medicaid and Medicare, and looking at some funding being cut. So this is an area that's going to be new for many nonprofits and new for the behavior health and mental health and substance use field. So we're trying to monitor it. You know, our major mental health and substance use organizations and peer organizations, they're doing the best that they can to monitor it very closely so that they can get information out there to our communities to let them know what they can do, hopefully, to supplement. But we're in a very unique time right now.
Yeah, we are, but you guys are working so hard. It looks like there's a lot being done in this space. So that's really awesome, where I hear you saying that even law enforcement, there's a program working towards that for them to help deal with that space, medical professionals, and then even people who just everyday layman people to learn how to, really advocate in these spaces. So thank you so much for sharing this. I know you have some things coming up that I want you to mention. One being the men's wellness event that you have going on next month. And then you have a few others. Would you like to share those coming up in Georgia? Because there will be people watching this that are in the state of Georgia, and I want them to attend and advocate in these spaces so we can see more greater impact. So
absolutely. Well, again, this is our 6th annual Black Men Thrive Symposium. So it'll be Saturday, June the 28th from 9 a.m. to 1 p.m. at Berean Christian Church, which is at 2201 Young Road, Stone Mountain, Georgia. And we are really, really blessed this year. We have about 9 speakers, Black male speakers, all with amazing credentials, amazing backgrounds, effective in their community. So you do not want to miss them. We will have a special guest keynote, which will be Congressman Hank Johnson. So those of you who are residents here in Georgia, you have heard his name. I know you have. Please, you want to come out and hear him. So we'll have our keynote. We have something called a sharing hope moment, where I allow someone to share about their lived experience, a Black male. And then I also have a panel discussion, which is very, very thorough, where we will really do a deep dive into where we are within our communities as it relates to Black men's mental health. And then I will have breakout sessions. And so I have about 4 different breakout sessions that will cater to most individuals who are there, and you just pick which one you want to go to and listen and learn. And then I will also have resources that are there that are available to you. So we will have Nami DeKalb and Nami Gwinnett to share all of their beautiful resources there. So again, you just don't want to miss it. Come.
Yes, come, and I will put the information in this video where you guys can check out the actual flyers to attend, all the speakers, the time, the location, all of that information in the description. So please come out and support so that we can see greater impact in this area. We can advocate in these spaces. Come out and support. Now, if they wanted to maybe do a session or 2 with you, what is your website, or how can people get in contact with you, Dr. Izzard?
Absolutely. I do have my own website, so you can definitely share that with them as well, which is shekinahcts.com. So that is ShekinahCts.com, as well as you can find me on social media as well. So I am definitely on Facebook, and I have Shekinah Counseling as my name on Facebook as well. You're welcome to follow me on that page. I post a lot of my events and different things related to the conferences that I'm attending, and all of that on that page as well. So again, that's how you can get in contact with me. And thank you again for having me today to talk about my gift and passion area.
Thank you so much.
Which is mental health. Happy Mental Health Awareness Month, everybody.
Yes, thank you. Happy Mental Health Awareness Month, guys. And thank you so much for tuning in. Make sure you like and subscribe. Chat in the comments and let me know if this video was helpful. Let me know so that I can keep videos like this coming, guys. And so again, thanks for watching. Happy Mental Health Awareness Month.